The government may be advocating for exclusive breastfeeding in the country, but for breastfeeding mothers, especially career women, the challenges have been enormous. Many of them have been, in many cases, been forced to express milk that they usually leave with their house helps, who have to feed their young ones for the better part of the day before they link up with them in the evening for another breastfeeding session. To counter such challenges, mobile telephony provider Safaricom has established a breastfeeding center for nursing mothers who are employees of the company.
In leveling the playing ground for the working woman in regards to the healthy competition between the working woman and the man at the workplace. And it is in the light of this, especially because at Safaricom our gender balance is 1:1, which is 50% women.
Here, nursing mothers are given periodic breaks through which they are allowed to breastfeed their newborns at least for the first 1,000 days. The setup also allows for facilities from where breastfeeding mothers can express their breast milk and store it hygienically. But it is not all gloom and doom for the other nursing mothers in the other public and private institutions. This could become a reality to so many mothers if the Health Bill 2015 is assented to. For they are likely to enjoy similar privileges like their counterparts at Safaricom only if the Health Bill 2015 is enacted into law. If it sees the light of day, the bill will see female employees enjoy their maternity leave on full pay as per Section 29 of Employment Act 2007 and still nurse their young ones at their workplaces upon resuming work after they attend their maternity leave. And as Kenya joins the rest of the world in marking the World Breastfeeding Day, Acting Director of Medical Services Jackson Kioko challenged public and private institutions to establish special centers just like Safaricom company to be used by breastfeeding mothers.
Identified breastfeeding room that is going to be used by anybody who is breastfeeding on that side. All right? How we are going to equip, how we are going to make sure it is in use, it is going to be done. I think there is no shortcut about it.
Such were the sentiments shared by various lawmakers who attended the celebrations. Members of Parliament have already approved the breastfeeding clause in the Health Bill 2015 that, if passed and enacted into law, will see public and private institutions establish centers for breastfeeding mothers countrywide. Rose Gakwo for Channel 1 News Hour.